For your patients and residents with retracted or indwelling penises, you will fold the wrap around the scrotum as well as the penis in order to secure the wrap. We suggest you apply either zinc spray or barrier cream on the scrotum, as the scrotum will be in the wrap. Place the wrap on the patient's abdomen with the white absorbent side up. Again, make sure the round edge is towards the head of the body and the two flaps are towards the legs. Legs to legs. Slide the wrap down so that the inner ring is as low towards the base of the shaft as possible, or if totally retracted, the tip of the penis. Slide the pointed flap between the thigh and scrotum and then scoop up the entire scrotum, lifting upwards. Make sure the folded flap is as close to a 45-degree angle as possible. Then fold the second side over, slightly pulling upwards like last time. You want to make sure there's a snug, semi-tight fit at the base of the genitals to prevent possible leakage. Then make sure to pinch the hook fastener and inner flap together to get good adhesion. You're not quite going to get a perfect flat fan shape like with a standard application, as there's more volume inside the QuickChange. And again, the top remains open to allow heat and moisture to escape. Now let's review some tips. It's really important to make sure that you give that Velcro a really good pinch. And when repositioning a patient or turning him on his side, consider changing him first, as a soiled wrap can pull away from the patient. You can place a second wrap underneath to hold a wrap in place if he is spending a lot of time on his side. You can also use mesh briefs or underwear for patients with severe spasms. For your patients with a heavy flow or high urine pressure, or again, if you just want to stay away from catheters, you can take the wrap or use a second wrap as with the standard application. If you have any additional questions on the QuickChange wrap and how it can be more effective for your usage, you can find us at our website, QuickChange.com, where we have several videos on the wraps as well as various materials and instruction guides for downloading. We also offer virtual in-servicing live from our broadcast studio over platforms such as Zoom and Skype, where you and your team can interact with our clinical educators. Feel free to call us anytime at 1-800-206-2816, where we can walk you through any situation.